As we approach the 19th of July, you'll hear a lot of discussion about personal risk. So I thought it was worth sharing some thoughts on this with you to help you reflect on how you can approach your personal risk assessment after the 19th of July, as many of the legal restrictions come off. COVID is still here. We are seeing case rates continue to rise as people are mixing more, but the vaccine is showing evidence that it's breaking the link, particularly between severe illness and death. And that's really good news. But it does take 2 doses of the vaccine to get that protection. And there are still a large number of us that have only had our first jab or still haven't even had that. So when we talk about personal risk, there are a couple of ways to think about this. First of all, there's your risk as a person yourself. There's the risk in relation to the household, the people you live with, and then there's the risk around the environment, the place that you're going to. So in terms of your personal risk, think, am I at more risk of COVID because I may be more elderly? I might be overweight. Carrying that excess weight can really put you at higher risk. Do I have a long-term condition like diabetes or a disability that puts me at higher risk? And also there's non-health factors, like if I tested positive and I'm now going to have to spend 10 days isolating at home, can I afford to do that? The impact of the isolation period as well. And can I afford to become unwell? So thinking about your personal risk in that context is the first place to start. The second thing to think about is the people you live with. Are the people you live with vaccinated? Are they protected against serious illness? What would it mean to them if you tested positive? Do you risk bringing COVID back into the home? Does it mean that they'll have to take 10 days off at work because they're a contact, because they live with you? And what are the implications of that? The third element of thinking about the risk is the place you're going to. First of all, is it well ventilated? Does it have lots of airflow? Because we know that that really reduces the risk. Is it a very crowded space? Are people crammed in around you? Or is it a space where there's lots of space to move around and you don't have to be right up close to people? Is it a space where there are people are going to be there that you know? Or is it a place with lots of strangers where you don't know what people's vaccination status are? You don't know if they've tested or not, those kind of things. So they're all things to consider. Start with your own personal risk. How sick would you be if you caught COVID? Are you vaccinated or not? Have you had both doses? Then think about your household, the people you live with, and then think about the place you're going and how safe is it and how much of a risk is it? There are, of course, things you can do that reduce the risk. We all need to keep washing our hands regularly because it's really good at protecting against other bugs as well as against COVID. Definitely get the jab if you haven't had the vaccine. All of the evidence says that having the vaccine is far safer than catching COVID. Irrespective of how old you are, it makes a difference. And that the side effects that we've seen are very, very rare compared to the side effects and the serious illness that comes with COVID. So get the vaccine, keep washing your hands. Lateral flow before you go. While we still have these tests, actually, if you are going somewhere where you're going to be mixing with people, particularly if you're going over to, say, someone else's house and they haven't had both doses of the vaccine, doing a lateral flow before you go is a really good way of just making sure you haven't got the virus and you're not spreading it without any symptoms. So, test before you go is a really good rule of thumb. And then finally, if the area you're going to is crowded, is somewhere that hasn't got good ventilation, then wear a face covering. Doesn't matter whether other people are wearing one or not, but if you wear a face covering, you're playing your part by keeping your germs close to you, keeping some of their germs out of your nose and mouth. So you can still wear a face covering after the 19th, it just won't be policed in the same way, but it is one of the ways you can help reduce the risk. Thinking about risk and COVID is the same kind of thing when we drive a car or when we go into a building, we think, is this a safe environment if there was a fire? Is there a fire escape or not? Those are all the same kind of thoughts that we have, and we all drive our cars at different speeds, and people are variable about how good they are at sticking to the speed limit or looking in their mirrors before they reverse. And some of that's about protecting ourselves and some of it's about protecting other people. And COVID is no different. The 19th of July is a day in which a lot of things will change in terms of the regulations, but sadly COVID hasn't changed. It's still infectious, it's still dangerous, it's still putting people in hospital, and it is still killing people. We are in a much better place now because we have the vaccine. And the more of us that get 2 doses of the vaccine, the easier it is for us to live freer lives and to not have to worry about these risks quite as much. So on the 19th of July, think about your personal risk, your household risk, and think about the places you're going and what you can do to help keep COVID under control.